This is Dr. Lindsay Remy. I have a few tips for you as you recover from your knee replacement. What do I do to take care of this knee now that I'm home? I have a few different things for you to think about. One is range of motion. So knee replacements like to stiffen up, and so I need you to be fully bending and fully straightening your knee from the very beginning. At least once an hour while you're awake, I want you to push your knee flat, fully straight, and then relax, and then bend it up as far as you can. It can be helpful to have a little strap to take your foot and help pull it in. It's also helpful if you rest your leg in that fully straight position, especially before you get up and walk, because if your knee is stiff with a little bit of a bend in it, it does make it very hard to walk. So fully bend and fully straighten about once an hour during waking time. I also would encourage you to get up and walk at least once an hour. This may mean just standing up for a few seconds. It may mean a full lap around the house or just changing positions, but frequent movement helps prevent blood clots. One of my primary goals for you is to stay safe. And while I want you to walk as much as you feel able to help build up strength and stamina after surgery, some people just aren't feeling safe to do much walking in the first day or two after knee replacement. And if that ends up being you, please know that you have my blessing to not get up as much. In fact, if you need to delay your initial physical therapy appointment from the scheduled first day after surgery until the second day, that would be fine if we need to do that to keep you safe. Everybody's ability to walk after surgery is different, so please know that I want you to stay safe more than I want you to recover as fast as possible. As safe as possible beats as fast as possible. Okay, everybody is different in exactly how strong they feel after surgery. So we want you walking if you feel able to. That does help prevent blood clots, but really any movement is better than no movement at all. And if you're feeling like you might fall, please do more sitting. Your surgical dressing is covered with gauze and these clear plastic pieces of tape called Tegaderm. This is a waterproof dressing. I have covered over top of that with an ACE wrap that I ask you to leave on for 3 days. That helps control the initial swelling. But once you take that off, the dressing underneath is waterproof and you are safe to shower in it. It typically stays fully sealed, but if you have any problems with feeling like it may have gotten wet underneath, please reach out to my office. Most people don't have any bleeding through their incision because I use multiple layers of closure, including a final layer of glue that keeps it nicely sealed. But if you are somebody that has had bleeding into your surgical dressing, please notify me, especially if it's more than just a couple spots. I need to be informed so that we can change some of the details of how we take care of you. Unfortunately, we can't take your pain away. The best I can do is to keep your pain at a moderate level. I want you to stay on top of your pain control by using the medicines that I've provided, but at the same time, know that you are going to have to push through some pain and bend and straighten your knee even though it is uncomfortable. You can rest assured that even though it feels like you might bust your incision open by bending your knee, you won't. The incision is very strongly closed, and the only problems I've had with incisions reopening are in the very rare case of a fall directly onto the incision. So please know it is safe to bend your knee even though it's uncomfortable, and doing so helps prevent scar tissue from forming. In order to stay on top of your pain control, I recommend that you keep your medicines on a specific schedule for the first 24 hours after surgery. And then if at that 24-hour mark you're doing really well, you can start spacing out your medicine a little bit more to really prioritize using the medicine when you are in the most pain. Most people can be off of all narcotic pain medicine between 3 and 5 days after a knee replacement. But of course, we all experience pain differently, and we all respond to these narcotic pain medications differently. So your individual needs might vary. Please reach out to me if you have concerns about how your pain control is doing. Physical therapy is an important part of this process. For most people, they go to an outpatient physical therapy location the day after surgery. Some people do better with physical therapy coming into their house so that they don't have to travel. The decision between outpatient physical therapy and home physical therapy needs to be made as early in the process as possible because setting up home physical therapy can take a few weeks. Please let us know if you want home physical therapy. The downside to home physical therapy is they only have the equipment that is available within your home. So they may not have a bike or weights unless that's something you have in your home gym. That's the reason that for most people, I recommend going to an outpatient physical therapy center, such as we offer in our multiple HMG locations, because then you would have the availability of all of those resources to really help your leg get stronger. If you need home physical therapy, that typically is only for 2 or 3 weeks before you graduate from that and move on to an outpatient physical therapy location. Your physical therapist will help teach you how to best strengthen your knee as quickly as possible after surgery. They will also be able to work on fully bending and fully straightening your knee with you. They can also be another resource to check in on your incision, to check in on swelling, and just to make sure you're staying safe throughout the process. I work very closely with the Holston Medical Group Physical Therapy Department, and while you're welcome to go anywhere that you feel comfortable, please know that the communication with physical therapy within HMG is excellent, and they will be the first to notify me if there are any concerns with your recovery. Movement is the most important way to prevent blood clots, but because blood clots are one of the major risks of knee replacement surgery, I ask most people to take aspirin, 81 milligrams twice daily for the first 2 weeks. If you have a history of prior blood clot or a very strong family history, I may have prescribed something different, so please talk to me about that if you have any concerns.